In this video, you're going to learn which sleeping position may raise stroke risk, especially in seniors, and what you should do instead to protect your brain and circulation while you sleep. We've researched stroke patterns, brain blood flow, and sleep studies for seniors, and this sleeping advice comes directly from clinical insights and neurology-backed data. These are the same tips doctors recommend to seniors with a history of high blood pressure, sleep apnea, or poor circulation. And today, you'll discover why back sleeping might actually be harmful for certain seniors, how to sleep to improve brain oxygen levels, and the one position most experts agree is the safest sleeping position to reduce stroke risk after age 60. Most people don't realize this, but strokes are more likely to happen in the early morning hours, especially between 6 a.m. and 12 p.m. This has a lot to do with something called your circadian rhythm, your body's internal clock that controls blood pressure and hormone levels while you sleep. According to studies published in journals like Stroke and the American Heart Association, blood pressure naturally rises just before waking up. This early morning spike in pressure can trigger a stroke in people who already have narrowed arteries or other risk factors. Seniors, in particular, are more vulnerable because their arteries may already be stiff or partially blocked, making these blood pressure changes more dangerous. When we sleep, especially if we're in one position for too long, blood flow slows down and that can be risky for older adults. The body needs constant movement to keep the blood circulating properly, especially in the legs, neck, and brain. Seniors who may already suffer from poor circulation, diabetes, or limited mobility are at an even higher risk of developing blood clots during the night. According to research from the National Institute on Aging, being sedentary for long stretches even while sleeping can contribute to deep vein thrombosis, which can lead to stroke if the clot travels to the brain. That's why movement and good sleep posture are so important for overnight brain health. One of the biggest hidden dangers during sleep is sleep apnea, a condition where breathing repeatedly stops and starts during the night. This leads to drops in oxygen levels, which can be extremely harmful for the brain. Studies from Johns Hopkins Medicine and the Sleep Foundation show that seniors with untreated sleep apnea are 2 to 3 times more likely to have a stroke than those without it. The lack of oxygen puts extra stress on the heart and blood vessels, increasing the chance of clots and reducing brain function over time. Sadly, many older adults don't even realize they have sleep apnea, making it a silent risk factor for overnight strokes. If you snore loudly or wake up tired even after a full night's sleep, it might be worth getting checked. Number 1 position. Right side sleeping. Sleeping on your right side may feel natural and comfortable, but for many seniors, it can silently increase stroke risk. This position can cause the neck to tilt in a way that compresses the carotid arteries, the major blood vessels that carry blood to the brain. If these arteries are already narrowed due to age, high blood pressure, or plaque buildup, that compression can further reduce blood flow to the brain during the night. Over time, poor circulation while sleeping may contribute to an increased risk of stroke in seniors, especially if this position is used nightly. Number 2 position. Stomach sleeping. Sleeping on your stomach is considered one of the worst positions for both spinal alignment and brain circulation. When you lie on your stomach, you must turn your head sharply to one side to breathe. This extreme neck rotation can significantly compress both the carotid arteries and jugular veins, restricting blood flow to and from the brain. In seniors, this is especially dangerous because their blood vessels are often more fragile or partially blocked. Also, stomach sleeping can put pressure on the chest and diaphragm, making it harder to breathe smoothly, which may lower oxygen levels during the night. A hidden factor that may raise stroke risk while sleeping. Number 3 position. Back sleeping with poor pillow support. Back sleeping can be healthy for some, but only when done correctly. If you sleep on your back with a pillow that is too high or too low, it can throw your neck and airway out of alignment. This may worsen snoring or trigger sleep apnea, which causes repeated interruptions in breathing during sleep. When airflow to the brain is reduced, it leads to drops in oxygen, something that's closely linked to higher chances of stroke in seniors. Studies have shown that untreated sleep apnea doubles or even triples the risk of stroke, especially in people over 60. If you snore loudly or feel unrested in the morning, this sleeping position may be putting you at silent risk. For seniors, the wrong sleeping position may raise stroke risk more than most people realize. As we age, our arteries naturally become narrower, making it easier for blood flow to be restricted, especially when sleeping with the neck twisted or bent awkwardly. This is common during side or stomach sleeping, which can quietly reduce circulation to the brain overnight. In addition, Many seniors deal with reduced mobility and undiagnosed blood pressure fluctuations, both of which make the body more vulnerable during sleep. If you have health conditions like atrial fibrillation, high blood pressure, or diabetes, poor sleep posture can further increase the risk of a stroke while sleeping. That's why sleep position isn't just about comfort, it's about protecting your brain and heart health as a senior. If you're wondering which sleeping position may reduce stroke risk, the answer is simple: left side sleeping. Experts often recommend this position for seniors because it offers multiple health benefits. Sleeping on your left side can help improve blood circulation to the brain, especially by avoiding pressure on the major arteries. It also helps reduce acid reflux and keeps your airways more open, which is important for smoother breathing during the night, a key factor in stroke prevention for seniors. Another safe option for some is back sleeping with your head slightly elevated. This position can help keep the neck and spine aligned and promote healthy blood flow, as long as you don't have sleep apnea. If sleep apnea is a concern, back sleeping might actually make it worse by blocking airflow. No matter which position you choose, it's important to use a cervical support pillow to keep your neck properly aligned, which reduces strain on the arteries and improves brain oxygen levels while you sleep. Along with choosing the right sleeping position to lower stroke risk, there are a few extra habits that can help protect your brain while you sleep. First, try to avoid heavy meals or alcohol before bedtime. Both can interfere with digestion and blood pressure, making sleep less restful and potentially increasing the chance of stroke in seniors. Another helpful tip is to elevate your head slightly, especially if you struggle with high blood pressure. This small adjustment supports better circulation and reduces pressure in the brain during the night. Also, try to keep a consistent sleep schedule. Regular sleep patterns can throw off your body's rhythm and affect heart and brain health. Tonight, try adjusting your sleeping position. Even one small change could make a big difference in protecting your brain and lowering your stroke risk. If you found this information helpful, please share it with a loved one. You never know, it might just save their life. And don't forget to hit the subscribe button for more trusted senior health tips, including how to improve brain circulation, sleep safely, and live a longer, healthier life.